Okay, great. And then do me a favor, put your hands nice straight out. I'm going to go ahead and look at your hands, and everything looks good. I don't see any issues with her joints. That would indicate any osteoarthritis, but I don't suspect that with you, with your age. And then do me a favor, go ahead and cross your arms like this and put them out. Okay, and then flip your wrists up and down. Does that cause any pain?
Nope.
And do your arm a full motion like that. Does that cause any pain?
No.
Okay, good. All right, do you have any questions about that?
No.
Okay, so the next thing that we'll be doing is I'll have you lay flat,
Okay.
and we're gonna go ahead and listen to some lung sounds, some heart sounds, and bowel sounds on your tummy. Is that okay?
Yep.
Okay, and then we're gonna check for pulses and swelling and things like that on your feet, and then we'll be all done, okay?
Okay.
All right, thank you. Okay, so next, Destin, I'm going to go ahead and listen to your heart and your lungs, okay, for any abnormal sounds. And with your lungs, what I'll be looking for here is any crackles or wheezing, rubbing sounds, and that would be something abnormal. So what I want to hear is the air flowing through your lungs properly. And if you could just go ahead and breathe normally. What I'm looking now is just to see if she's breathing without any difficulty, and it doesn't look like she's struggling at all, so that's good. Do you ever have any issues with breathing, or when you exercise and get winded, or asthma? No? Good. Okay. So I'm going to go ahead and listen. So you can take some normal deep breaths. So what I'm going to do is start here at the apex of her lungs, the second intercostal space on the right and left. Good. Big deep breath in and out. And go ahead and lift your arm. I'm going to go ahead and listen here as well. Okay, I'm going to listen on this side. And then lift your arm here. Perfect. Okay, so I didn't hear any rubbing or anything like that. And with the lungs, there's the 3 lobes on the right side, so and 2 lobes on the left. So I went and had listened to everything. And if you can go ahead and just turn a little bit facing this way. Perfect. Okay, and I'm gonna just what I would be inspecting here is go ahead and lift your arm up. I'm gonna just kind of look anterior, posterior, make sure everything is even and there's no barrel chest here. Everything looks good. And I'm going to listen to your lungs on the back. So if you can go ahead and face that way just a little bit. Perfect. Same thing here. I'm going to listen. Big deep breath in and out. Again. Two more. Good. Sounds really nice and clear. Okay, and then I'm going to go ahead and listen to your heart. Mm-hmm. And I'm going to be inspecting 5 different areas to listen to the heart. And we'll start at the apex of the heart and work our way down. Okay, and what we're listening for is the valve sounds, 4 of them. Okay, so go ahead and listen. Good. Sounds really good. So here I'm doing the aortic valve and the pulmonic valve, and then we'll be doing the Ebbs point. It's just kind of the center point of the top and the bottom, and down here is the point of max index. So that will be the loudest there. And what I'm listening for is a lub dub back and forth, lub dub S1 S2, and it gets is really loud S2 on each side here. Okay, and everything sounded really good. Do you ever have any issues where you feel like you're dizzy or out of breath or chest pain or anything when you play sports? No?
No.
Okay, good. All right, so And the next thing I'm going to do, oh, while you're looking this way, I forgot earlier to look, is go ahead and look that way. And I'm going to just be inspecting here and tilt your head to the side away from me. Okay. Looking for any, for jugular distension here, and that looks totally normal. Does that hurt at all when I palpate down there? No. Okay, good. All right. So the next thing I'm going to have you do is I'm going to listen to your tummy. Okay, is that all right? I'm going to have you lay flat. Okay. And what I'm going to do is I'll do this over her shirt. Okay. So with doing assessments with the abdomen, it's one area that you don't palpate before you auscultate. So I'm going to go ahead and just examine, inspect, and what I'll be looking for is any lesions, any swollen areas, any masses. And then the reason why I don't palpate before auscultate is if I did that, then it would increase the bowel sounds. And what I'm going to be doing is also listening for bowel sounds, and that will, if I palpate it first, it will make it hyperactive. So we don't want to do that. Okay, so what I'm going to do is just inspect, and because and first thing I'm going to look at is the shape of her abdomen, and the contour, and hers divots in, and the umbilicus right above there. I'm looking for on thin people, you can see the aortic pulse here, and I can see that there. Okay, so, and then so I'm just gonna go ahead and lightly just look here. Okay, perfect. And I'm gonna go ahead and listen. Okay. All right. Okay, so she had about 32 bowel sounds per minute, and that's normal. 5 to 35 is within normal range. And one thing I actually did forget, when I was listening here to the point of mass index, I'm going to take your pulse there, and that'll be the most accurate pulse. Okay. I'm going to go ahead and check that. Okay, good. And that's 68. So anywhere from 60 to 100 is normal, and that's good. Are you doing okay? Yeah. Do you have any questions? No? Okay. So the next thing I'm going to do is go ahead and palpate your stomach. Okay, so I'm going to go in a circular fashion, starting on the left side here, clockwise. So I'm going to just palpate about 2 centimeters deep, so not too hard. Just tell me if you have any pain, and what I'm looking for, like I said, is any masses or pain here. Okay, and then I'll go ahead and do a deep palpation where I'm really push like 3 to 4 centimeters deep. Okay, any pain? Nope. Okay, good. All right, so I'm gonna have you just lay there, and I'm gonna go ahead and feel your pulses, okay? The popliteal pulse behind her knees, okay? Okay, strong, and pulses down here on your feet, on her feet, the inside here, tibial pulse on there's good, strong. Good, and the pulses on feet is also nice and strong. Okay, so the next thing I'm gonna do is, can I pull your pants up on just on your leg a little bit? Okay, here, and then also down like this. Okay, so I'm gonna push on the tibia here, Does that hurt at all?
Nope.
Okay. And what I'm looking for